name is Kolk. I'm a public health student and finishing up my internship with Project CARA at MAHEC, the Mountain Area Health Education Center located in Asheville, North Carolina. So first off, I'm going to tell you about my objectives and how I completed those throughout my internship. So number one, my objective was to write a literature review regarding comprehensive care in pregnancy for substance-using women. So this was the target population of the particular clinic I was working at Project CARA, and I'm actually very interested in the subject, so my final literature review is about 14 pages and included 5 different studies that detailed substance use comprehensive care in both the US and Canada and how those differ. My second objective was to create and pilot test some policies for MAHEC. They assigned me 3 policies. They're UDS, UDT, and DANCA policies. This is their urine drug screening, urine drug testing, and the patient did not show for their appointment policies. So I actually went through a ton of paper during this part of my project, but I would meet weekly with them and talk about what I had created and revise it and then move on to the next copy. So this is actually a giant stack of all the different drafts I had of the written policy. And I also decided to create some flowcharts, which ended up being decision trees, which is something that the students at MAHEC really like. So decision trees are commonly used in medical, making medical decisions. So here's my big pile of those that I went through, and my final drafts were actually really appreciated, and they have some policies they're actually going to submit and use for the program and potentially implement in other programs. My third objective was to create educational materials to educate others on how to use the policies I created. So to do this, I created some different PowerPoints, basically, that would give a student or a provider the ability to sit down, read through them, click through them, and then in about 20 minutes or so be able to take a little test on it and find out how much they understand it, and if they understand it, to be able to go out and practice it. So I created some different little flowcharts for them that would guide them through the different policies being carried out. They really liked this one because I compared what the nursing staff does on the bottom to what the patient experiences at the top, and this is for the UDS policy. And for the final bit of this, I created some tests for them to fill out and an answer key for this as well, for them to figure out what goes where, how to use the different matrices that I put in the PowerPoints to really identify what to do in different situations. And they also really enjoyed those, so that felt really good. So some of the lessons learned through this experience were definitely find out the expectations for yourself before you start doing things. I mean, it's great to make a bunch of different drafts, but if you really know what they're looking for before, you won't have to revise as much. So for me, that was understanding the formal grammar that they required through policies. I had to do a ton of edits of grammar. It's not really my strong suit. Also, understanding citations. In my literature review, when I started, I had no idea. I thought I knew how to use APA citations, but I really wasn't doing it correctly this whole time, so now I have a much better understanding of that. So don't be afraid to ask questions about what they're expecting this to look like. In a similar vein, my other lesson I learned was definitely know your audience. I know we hear that a lot, like who is your target audience, but knowing the audience in this case meant I understood that they had a high motivation to learn and that they could handle more complicated information. As well, I started to understand that what they were looking for in policies was really decision trees, because doctors and young doctors especially are used to using decision trees to figure out what to do with a different patient. So this was something I wouldn't have understood if I didn't know the audience. As far as interning with MAHEC goes, I had a really great time, though there were definitely some frustrations regarding my MOU in the beginning, but once I got started, my big things to focus on would be definitely flexibility and communication. As far as the staff at MAHEC and the team I was working with, you want to really get to know them each individually and what they each expect and know how to communicate with each of them. So I met the behavioral health and the medical providers. So that was really interesting, but they definitely need you to be flexible to fit their schedules and be able to communicate with them on their own terms. So that's my summary of my internship. Thank you so much.